Ever since you became an entrepreneur, have you ever felt too busy, too stressed, too uninterested, too tired for sex with your wife or husband? If this concerns you, you probably ask yourself this question. Is it a scheduling problem? Is it a communication problem? An emotional problem? A medical problem? And how can you solve this? With Viagra, therapy? You deserve answers. Your entrepreneurial journey and personal life are connected. If one is doing bad, it will negatively affect the other. Hi brothers and sisters, I'm Moses the Pharmacoach, helping you young entrepreneurs in living an all-around healthy life. Today we will talk about sexual dysfunction. For the new people here, my name is Moses Boachi. I'm an entrepreneur and a pharmacist practicing in Canada. And on my spare time, I'm a YouTuber making content on health, faith, and entrepreneurship. Don't forget to subscribe if you haven't already. I'm not a psychologist nor a sex therapist. I'm a pharmacist. So what I'll be able to do for you in this video is to give you more of a medical perspective when it comes to sexual dysfunction. Considering that sexual dysfunction is multifactorial and shows many differences between men and women, this video will specifically be about sexual dysfunction in men. Ladies, I will make another video for you, but you can watch for your significant other. In this video, I will tell you about the signs, the causes, and the available treatments for sexual dysfunction in men, including Viagra, yes, and I will finish the video with what the Bible has to say about sex. Sexual dysfunction in men can take many forms. All the following symptoms are considered problems if they persist and happen repeatedly. The symptoms can be erectile dysfunction, which is the inability to achieve or maintain a satisfactory erection. It usually affects older men from 50 and up. The second symptom is loss of a sexual desire, which is an unexplained and prolonged absence of sex drive or loss of libido. Another symptom is premature ejaculation, which is when ejaculation happens sooner than desired with minimal stimulation. It affects around 1/3 of men at some point in their lives. Another symptom that is more rare is called Perel's disease, which causes the penis to abnormally curve and leads to painful erections. The most common causes of erectile dysfunction and loss of sex drive in men are many. It can be related to a medical condition such as depression, diabetes, heart disease, back injury, prostate surgery, hormonal imbalances such as a low testosterone level, and many other chronic disorders such as multiple sclerosis. Some life habits can also lead to sexual dysfunction. Alcohol, lack of physical exercise, smoking, obesity, something that affects a lot of entrepreneurs, stress and anxiety. And lastly, get ready, bicycling. Yes, there is a possible but controversial association made between erectile dysfunction and bicycling. When you sit on a bike for long periods of time, the seat puts pressure on the area between the anus and penis, called the perineum. The perineum is filled with nerves and arteries that supply oxygenated blood and sensation to the penis. For men to have an erection, nerve impulses from the brain send arousal messages to the penis. These nerve signals allow blood vessels to relax, increasing blood flow through the arteries into the penis. Any problem with these nerves and blood vessels can make you unable to have an erection. In other words, can lead to erectile dysfunction. That's why some men who spend a lot of hours on a bike have reported numbness and trouble achieving an erection. These reports are mainly from serious cyclists, and the problem has been noted with not all bicycle seats, but with certain ones. I'll put the link to the PubMed article in the description box below. Medication can also be the reasons behind sexual dysfunction in men. Some antidepressants have been associated to sexual dysfunction, particularly SSRIs, which are selective serotonin reuptake inhibitors. SSRIs are first-line treatments in many psychiatric disorders, such as depression and anxiety. Among the sexual side effects of SSRIs, we have decreased libido, difficulty achieving orgasm, and erectile dysfunction. SSRIs work by boosting the level of serotonin. Serotonin is a neurotransmitter that is active in the brain and in other parts of your body, including genital organs. Besides improving your moods and decreasing your stress, serotonin provokes a feeling of satiety that we get after an orgasm. It also diminishes sexual excitement. Despite everything that I told you, you guys shouldn't put an X on antidepressants because first, side effects are possibilities, not guarantees, and second, there are a lot of management solutions to their sexual side effects. And based upon clinical experience, sexual side effects induced by SSRIs resolve soon after the medication is stopped. If you want to learn more about the antidepressants, including the management of their side effects, watch my video called 7 Things to Learn About Antidepressants. The link is down in my description box below. The chronic use of opioids such as morphine and hydromorphone can also cause sexual dysfunction by lowering testosterone levels. Other classes of medications that have been associated with sexual dysfunction are certain blood pressure medications and prostate medication. Among these prostate medication, we have finasteride, which is also used to treat baldness in men. Although some recreational drugs such as cocaine and heroin can initially stimulate libido and sexual arousal, they ultimately reduce the ability to acquire and sustain an erection. Now let's talk about the available treatments for erectile dysfunction. There are various medications available. The most common prescribed meds are phosphodiesterase type 5 inhibitors, also known as PDE5 inhibitors. The main ones are sildenafil, brand name Viagra, tadalafil, brand name Cialis, and vardenafil, brand name Levitra. I will call them by their brand names not for promotional purposes, but rather because most people are more accustomed to their brand names than to their generic names. In order to understand how these agents work, you need to understand how an erection happens. First and foremost, you need a sexual stimulation. That sexual stimulation will provoke the release of nitric oxide in the corpus cavernosum, which is a sponge-like tissue on the penis filled with blood vessels. Nitric oxide is the first mediator in the process of erection. Its release will cause a series of reactions within the smooth muscle tissue of the corpus cavernosum. These reactions will lead to the production of cGMP, which is the second mediator in the process of erection. Increased level of cGMP produces smooth muscle relaxation in the corpus cavernosum and allows blood flow into the penis, ultimately leading to erection. PDE5 is responsible for the degradation of cGMP in the corpus cavernosum. By stopping the action of PDE5 inhibitors allow longer and more frequent erections. PDE5 inhibitors facilitate erection but are ineffective without sexual stimulation. Therefore, if your erectile dysfunction is caused by a loss of sexual desire, a PDE5 inhibitor is not the solution. PDE5 inhibitors have to be taken if needed 30 to 60 minutes before sexual intercourse, and not more than once a day. Cialis has the longest duration of action. It can last up to 36 hours, whereas Viagra and Levitra last from 4 to 12 hours. Lower doses of Cialis are available for once daily administration. This approach is as effective as taking a high dose if needed. When used correctly, PDE5 inhibitors are usually well tolerated. They don't only have a dilation effect on the penis, but they also cause dilation of blood vessels across the body. Their most common side effects are related to this dilation property and are dose-related. For example, they can cause flushing, which is the redness of the face and cheeks, headaches, low blood pressure, nasal congestion, heartburns. An erection that lasts more than 4 hours after taking a PDE5 inhibitor is a medical emergency. If it happens, you have to go to the hospital because this type of prolonged erection is often caused by blood clog in the corpus cavernosum, which can lead to permanent fibrosis of the penis and permanent erectile dysfunction. PDE5 inhibitors are contraindicated for patients with serious heart problems and for patients taking a class of heart medication called nitrates. Combining a PDE5 inhibitor with a nitrate can lead to a deadly drop in blood pressure. We have to wait up to 2 days to give a nitrate treatment to someone with heart problem if he has taken a PDE5 inhibitor. The recreational and abusive use of PDE5 inhibitors such as Viagra and Cialis can put you at a higher risk of stroke, especially if you take a high dose. It also put men at a higher risk of STDs because of the more intense and reckless sexual confidence and behavior it can lead to. When PDE5 inhibitors are ineffective for erectile dysfunction, there are other possible options that are available, such as the insertion of a urethral suppository into the penis, or the injection into the penis of a medication that also increases the blood flow to the penis. Like I said earlier, decreased libido in men and erectile dysfunction can also be related to low testosterone levels. That's why it is recommended to measure testosterone levels for men with erectile dysfunction. Testosterone replacement therapy has been shown to improve libido, sexual activity, and erectile function in men with low testosterone levels. Along with these treatments, or even before opting for prescribed medication, it's very important for you to work on and improve your life habits in order to overcome sexual dysfunction. I'm talking about exercising, eating healthy, weight loss, and quitting smoking and alcohol. Depression and anxiety can also be associated with sexual dysfunction, including erectile dysfunction. Mental health issues should never be overlooked, and you must seek professional help if you're having these problems. I made a video about this topic. It's called How to Deal with Anxiety. The link is down in my description box below. In this video, we've looked at the medical and mechanical side of sexual dysfunction. However, a lot of times the problems in the person's sex life can stem from social and relationship factors. Many couples have sexual problems for many reasons. For instance, miscommunication, lack of intimacy, lack of emotional connection, cheating history, busy schedules, not understanding your partner's love language, children, arguing, and even childhood trauma, such as rape and abandonment. These issues must not be ignored and must be seriously dealt with. In this situation, Viagra will just be a band-aid to cover the deep-rooted cause of your sexual problem. If you're watching this video and sex is a problem in your relationship, don't hesitate to seek help from a couple or sex therapist. I encourage you to read a very good book called Mating in Captivity. This book is about sex and intimacy problems in relationship. It was written by a couple therapist and sex expert called Esther Perel. Finally, as a Christian, I have to tell you that if you're having problems in your marriage, get on your knees and bring these problems to God through prayer. Yes, even sex problems. Let's not forget that God invented sex and He approves of it when it's done according to His will, which is within marriage. The Bible says in Hebrews 13 verse 4, "Let marriage be held in honor among all, and let the marriage bed be undefiled." This goes to show that sex between a husband and a wife is important and valuable. It should be honored, cherished, and enjoyed as the gift and the good that it is. Here are my final words for you guys. If you feel like you have a problem in the bedroom or in your relationship, take it seriously. Don't sweep it under the rug. Success in your personal life will translate into success in your entrepreneurial journey, and vice versa. I hope you guys appreciated this video. Don't forget to like this video, comment, and share it with a friend. Please subscribe to my channel to not miss a thing and to continue to refill your life. Because let's face it, you will reach your goals and dreams if you are healthy physically, mentally, and spiritually. I'll see you when I see you.